one, but a sort of composite look, and it's being watched very carefully. The other aspect to be watching for is your capacity to test, trace, follow up, quarantine, and isolate, because the concept right now is to keep this epidemic under control by having a public health system that can clamp down on every outbreak and every little fire that comes up. But if there's lots of them, which is not what we want to see, then the public health capacity to do that and must be monitored as well.
Thank you, Dr. Tam. Operator, next question on the line.
Thank you. The next question, la prochaine question est de François Carabin du Journal Métro. À vous la parole.
Question from Metro newspaper. Hello, thank you for taking my question. I'd like to speak about steps taken in schools. It's inspiring a lot of debate in Quebec and in Ontario. In Ontario, it has been chosen to impose the mask measure starting at 4th grade. I'm asking what Health Canada's position is. Are you in favor of elementary school students wearing a mask? What is your position on this? Wow, thank you for the question. Firstly, I can tell you that that Health Canada doesn't have a position. We agree with our authorities in all provinces and territories. We're in the process of carrying out analyses on all scientific data and experiments and experiences lived in other countries. The most important thing we see when we look at schools is when we look at community spread. We need to look at whether or not there is spread that is out of control in the community. In Canada, we have done a very good job, and that is why we are now at the point where we're asking ourselves what should be done next with schools. There really is a consensus that we know certain things that we can do to control the spread of COVID-19. But we also know that there are some unanticipated circumstances. When it comes to chronic illness and children, all experts tell us that mental and social development is very important for children, and this has to do with the school situation. For young children, it is very important to their social development for them to be able to play with their children and to meet other students at their school. And that is why we have arrived at this point where we now are. Regarding COVID-19, we know that there are certain levels of protection, such as social distancing, for example, good hand-washing hygiene, for example, and wearing facial coverings or non-medical masks. And that is true in all provinces and territories. And we can look at each school and its particular infrastructure to find out what the situation will be with the students and the teachers to ensure that they have good access to hand-washing stations. When it comes to hand washing, the position isn't quite so clear-cut. We know that, or rather, when it comes to social distancing, it's not as clear-cut. We know that children are susceptible to the disease, but we don't know if they can transmit it to the same extent that adults can. After 10 years of age, it is believed that children become like adults and they transmit the disease in the same way that adults do after the age of 10 years. There is a decision that must be made for each province and territory to determine what can be done to facilitate social distancing of 2 meters. And there are options. For example, perhaps a cohort of students could be maintained throughout the duration of the school year. And other than that, we have the matter of masks. From looking at other countries in the world, and also from looking at provinces and territories, we consider that wearing the mask is very important for all children over 10 years of age. We have looked at scientific data, and we know that it is effective to wear a facial covering. And so it might take a while for children to get used to it, not to touch their faces, etc. But this is something that I believe that all provinces and territories are still analyzing. A political recommendation has been issued in certain provinces. And it's important to continue analyzing and discussing this matter. The next school year in this COVID-19 context will be a certain type of experiment. I have heard it said that, oh, young children aren't capable of wearing a mask because they'll be playing with the mask, and so on. But I don't think we're giving enough credit to children. I think that some children have even started to get used to wearing masks over the summer. It's not a question of whether or not they're capable of wearing the mask. The real question is, can children wearing masks help stop the spread of the disease? When we look at the data, we see that there might be other options, but that is the option that we have now, given the data. Thank you. Follow-up question? Thank you. No, I do not have a follow-up question. Thank you very much.
Question?
Mike?
No, please.
You go ahead.
No, please.
Bonjour, Philippe Vincent Foisy de Radio-Canada.
Question from Philippe Vincent Foisy from Radio-Canada. Here I am, in person.
Je viens d'écouter ce que vous dites sur les masques.
I just listened to what you were saying about masks. But I'm not sure I understand. I understand the function of the masks. I understand masks are effective. I understand that children above the age of 10 years can spread the disease the same way that adults spread the disease. So we have an effective solution, and we have a population that can spread the virus like adults can. But we're not using that solution of wearing the mask as it would be done in, for example, a store. So I'm just trying to understand why you don't say that that would be the best solution. I know that provinces have to make their own decision, but you just said, all that you just said, that it's effective and it would be a good thing for children over the age of 10 to wear the mask as a precautionary measure. Answer: yes, but as I said, given all of the well-founded scientific data that we have to date, we've looked at 2 groups, so children under the age of 10 and children over the age of 10. This is a current issue that should be discussed and should be managed in all provinces and territories. And I think this is why each province and territory has developed its own strategy looking at the data. Because different scientists can look at the same data and might deduct differing conclusions from the same data. What I see from analyses is the following. Yes, children over the age of 10 spread the disease the same way adults do. And I think that's even the policy in Quebec, isn't it? Children of 11 or 12 years of age are considered like adults and they must wear the mask. Now, at school, I think that the principle remains the same. I think the question can be posed. Perhaps they won't look at a certain age specifically, but if we look at all of the data, we can see that there is not a lot of evidence to suggest that very young children spread the disease to other children or even to adults. So that's one thing that needs to be looked into. And another thing is the following. It concerns young children. And it's part of, and it concerns facial expressions. So very young children use the facial expressions of their teachers to understand. And so wearing a mask in that sense could really diminish
En suivi, j'ai une question sur le tourisme.
their school environment. Second question, regarding tourism. Some people are saying that a 14-day quarantine is mandatory when re-entering Canada. That is harmful to tourism. That doesn't help companies whatsoever. Is there any way over the coming weeks and months that that will be changed, perhaps through testing or otherwise? In the short term, do you think that restrictions will be relaxed for people returning to Canada? Answer. Yes, well, regarding technology and what we know about the virus, we know that the incubation period is 14 days. Everybody knows that now. It's 14 days for the incubation period. Now, regarding our borders and tourism, I can tell you a story. I'm a Trekkie. I'm like a Trekkie in English, but unfortunately, you can't do as you do when you're a Trekkie and show your badge and go through. We're not at that stage yet with COVID-19. But perhaps with more work, better testing methods will be discovered. We have many researchers working on tests, and some tests are not yet reliable. They're still being tested. So we don't know yet. Perhaps at some point, thanks to a combination of technology and new data on the virus, things will change, but the policy remains the same for the time being.
Hi, Mike Lecouture from Global National. Dr. Tam, I wanted to talk to you about the COVID Alert app. And what do you say to critics who say that the technology, because it is quite advanced, is limited in terms of its efficacy because it doesn't work on older phones, and oftentimes older phones are owned by elderly Canadians or lower income Canadians who are greatly affected by COVID-19?
Yes. So the COVID Alert app is a notification app, just to make sure other audiences understand this. So it alerts people in an anonymous way. If someone who's test positive puts a code in the phone, it'll alert people who have been in the proximity of that phone. If they also have the app. So I have also heard some feedback over the weekend in terms of what you just said, which is older phones perhaps past the sort of 5-year kind of newness. Is that a word? Older than the past 5 years, the app may not be compatible. And I'm not a technologist, so I think that has to go back to the Apple, Google, company for that particular indication. But just to sort of look at it from a public health perspective, you're right in that there could be people who don't have access to phones, who don't have a latest phone, who may not be able to use this, but I still think that it is as many people who can download it and use it as possible will make the app more successful. I'm actually thinking, in discussion with other medical officers of health, it may not be the sort of broadest coverage that you need, but what if you're in situations, for example, before you walked into a pub, before you walked into a nightclub, or other places where there could be a bunch of people that you may not know who's not in your specific social circle, where notification is particularly important. So maybe also targeting the application in certain settings and asking users to download it, who may in fact be the younger generation with the phones, is still, I think, very relevant for that setting. But I do think that this is something new, and as the application is being piloted and tested, some of these feedbacks will come back, which I think will be directed to the relevant people who can address that, which I can't do. But I still think, despite these gaps, we need to have a go at using it. And it may not have to be broad coverage everywhere, but certain settings that might be the exact settings that you want to use it in, workplaces or other areas where it is really helpful if people around you are notified without you having to, reach them, or public health having, really trying to catch people up as fast as they can. This might help them. So that's at least how I look at it. But I do think that if there are limitations, please send the questions in, and they'll be directed to the right place, I think.
Thank you.
So just as a follow-up, I wanted to ask you then, so how do you propose reaching those people of lower incomes and older Canadians who may be falling through that technology gap? And B, in your suggestion of a kind of a location-based thing, are you even exploring the possibility of a different app or a different notification system that may be applicable, as you said, to nightclubs, pubs, or bars?
Well, I think what I was thinking is that these are some of the discussions with other chief medical officers. That now they're asking people to, make sure you know your client list and keep it for a while. Well, this could actually be very useful. Use the COVID alert app. I'm not saying a new app, but that could actually be quite helpful if it's kind of difficult to keep, contact lists. But that's the kind of concept I think public health locally will provide these kind of directions to their businesses or these locations. But the COVID alert app might add a level of functionality so that, it could be an additional benefit. I think we've always thought of it as just another tool and can't replace the other existing tools. And so for the hard-to-reach populations, public health will still be doing the very, as rapid as possible, the contact tracing and individual contact tracing that's required. But, the pandemic is showing the sort of disparities in the pandemic itself and the accessibility to measures more broadly. So that's a wider societal issue. And I think some of the supports provided to more disadvantaged populations are really, really important. But needless to say, this is one layer, but it's not the only layer. So we may have to sort of continue to resort to some of these other measures, like keeping at your entrances to any establishment lists, or public health being able to, with everybody's cooperation, show up to be tested, show up to be connected if you've been told that a certain setting has experienced an outbreak. So those traditional means will continue. This adds additional functionality.
Thank you, Dr. Tam. Next question in the room.
Hi, Tom Parry with CBC. Dr. Bonnie Henry out in BC is saying that she's having a hard time getting reliable information from airlines to try and do contact tracing. I'm wondering if you're hearing that from other provinces, how big an issue this is, and I guess how much harder it makes it. And is there anything you can do about it, the federal government?
Yes, so I think what Dr. Henry is referring to is that getting what we call plane manifest has always been a challenge. And depending on the airline, some of it is missing all sorts of information so that you can't actually reach the persons in certain seats, if they stayed in the right seats, that is. So I think there's been a number of enhancements that would be helpful. One is, of course, the ability for us now to collect contact information from arriving international passengers. And the use of the ArriveCan app. I think if we can have everybody use that app, it would become easier, I think, for us to be able to ascertain what flight individuals have been on. But it is an area that other departments, such as Transport Canada, are sort of working through as well, which is why, as a sort of at the beginning of the epidemic, there was an effort to trace contacts, which was quite difficult, and we didn't have any yield. There wasn't an actual transmission event that we could detect on the plane. So the public health energy turned to managing the outbreaks domestically. Very few of our cases actually come from travelers at the moment. But now that our case numbers have gone down, there's been more interest in, well, why don't we follow some of these planes and see if there's been, any contacts at all that's been exposed or transmitted? But all I can say is we haven't got a reported case of transmission in flight. But I do think there's an opportunity going forward to maybe look at that in a new concerted way. And so if with the provinces, right now what we're doing is just putting up a list of flights with a positive case on it. Whether you've been exposed doesn't mean that transmission has occurred or that has led to a spread in the community. But I do think that more effort in looking at how we best get that contact information could at least help us evaluate the data better going forward. So I think we are in the process of looking at how we better do that.
And just in terms of, you were talking about before about a vaccine not being a silver bullet and this being kind of a multi-year process. Psychologically, how do you think Canadians should be preparing for the future, for, thinking about kids going off to school or people trying to plan a wedding or things like that? What do Canadians have to keep in mind as we look ahead to the coming years?
Well, I think collectively the sort of public health system is trying to look at, well, what are the sustainable ways that we can adjust our daily lives that can just keep going? So some of the more sustainable measures we keep messaging to Canadians in terms of as much as possible that physical distancing, don't go in crowds, maintain the number of contacts as small as you can, hand hygiene, but also more and more trying to convey the concept, what we call the 3 Cs, closed environments, crowded environments, and if you're close face-to-face contact with someone and speaking to them, we need to adapt so that especially high-risk people should avoid those sort of settings or to adapt those settings to reduce the risk. So you're seeing whether it's schools, whether it's universities, whether it's pubs, are trying to adapt so that we can just keep going without sort of escalating the transmission risk. And this concept is to keep the epidemic suppressed in a sort of slow burn and stop any kind of resurgences. So we may expect to message to Canadians that these things, and wearing a mask, by the way, and we just talked about, then becomes part of your daily routine as you go out the door. You have your hand sanitizer, you have a mask. If you go into a closed space, you're going to put it on. If you can't distance yourself, can't predict, you're going to do that. And so that kind of behavioral change doesn't come overnight. But what I think we're all heartened by is that the majority of Canadians are following public health advice. and kids can be taught, so that we begin to continue in this sort of adapted way of living. And so I think that's at least one aspect, while we're still researching treatments, vaccines, better diagnostics. So better diagnostics might help us in certain ways of returning back to normal a little bit more. The question about, is the 14-day quarantine a concrete thing? Well, we'll keep reevaluating it. Right now is the most reliable method. Is there an ability where we can test people during the quarantine period to adapt that quarantine period? That is under active evaluation, but it's still not as certain as that 14 days. So I think
that is federal government health officials giving an update on COVID-19 measures. Of course, Chief Public Health Officer Dr. Theresa Tam there says a vaccine, a very important aspect of COVID-19 response, but says, quote, it's not the silver bullet solution. This is the same message that was shared by the head of the WHO over the weekend. But the health officials are also saying it's important to temper people's expectations about a COVID-19 vaccine and to expect issues such as distribution. So saying that right now. Also, the officials were asked about masks only being mandatory for students grade 4 and up. What they say is that they will leave that up to their provincial counterparts. And Dr. Tam was asked about the COVID Alert app that was introduced by the government just last week, and the fact that many people can't use it because it doesn't work on older phones. Dr. Tam says, yes, that may be the same, that may be happening, that there may be gaps, but they still have to have a go at using it. Returning now to breaking news. A massive explosion has rocked Lebanon's capital in Beirut. We're hearing reports that there are at least 10 people dead. Those are initial reports. As you can see, the blast and the power have overturned some cars. The explosion appeared to come from a warehouse at Beirut's port and caused wide-scale destruction. Local media are reporting the explosion happened in an area